Navigating hormone replacement therapy can feel overwhelming. Let me share my wife's journey as well as some of the research that I've done to make this decision process a little easier for you. Accept my challenge about being open-minded about hormone replacement therapy. I want to thank Hone Health for making this educational series possible. As I was creating this episode, I was tempted to just give you a bunch of facts and scientific studies about hormone replacement therapy. But the more I thought about it, I thought it would be better to go through the process of myself and my wife's decision-making process, which took us from why she wasn't taking it to why she now is taking hormone replacement therapy. Let's say you're a woman in your 30s, you're feeling good, you have high levels of estrogen, progesterone. Yes, they're fluctuating a little bit throughout the month, but in general, your levels are very high at this point in your life. And then when you reach midlife for the first time, these levels start to go down. Now, for some of you, who we call cruisers, you don't really feel this. It's not really having an impact on your life. For some other women, who we affectionately call grinders, they're having a little bit of a difficult time with this changing hormonal environment. And then for others, who we call the train wreck experience, you're not in a good place because of these decreased hormones. You have elevated levels of anxiety. Some even have depression, not recovering from your workouts, joint pain. Things are not going well because of the menopause transition for some of you. You have two decisions you can make at this point. One, you can be closed-minded about the possibility of exploring if hormone replacement therapy would be a good decision for you. Or you can be open-minded and investigate if hormone replacement therapy could be a benefit to you. And when I say hormone replacement therapy, I'm referring to two specific hormones, estrogen and progesterone. Now, if you have a uterus and you're going to be prescribed estrogen, you're also going to be prescribed progesterone as well. Estrogen alone may increase your risk for uterine cancer, but when you add in progesterone, it lowers this risk. One of the things as I did my research on hormone replacement therapy was that it was more than just about helping women feel better. It wasn't just about improving sleep, eliminating night sweats, lowering hot flashes. There was also a potential health benefit that hormone therapy can provide. And this is a benefit that you don't feel. So to summarize, what I learned about hormone replacement therapy is that there's two guiding reasons why women should consider this. One is to make them feel better, and the other is for long-term health benefits. And as always, the decision to take hormone replacement therapy is between the patient and her evidence-based physician. I'm not telling you or anyone that watches this that you should go on hormone replacement therapy. I am asking you to do your homework and to be open-minded and to see if hormone replacement therapy would be a good decision for you. Now, I want to give one warning here. Some of you going through menopause will think or will have this thought process that you don't feel bad. You're not having joint pain, you don't have night sweats, your sleep is fine, you're recovering from your workouts. And because you don't really have any bad experiences with menopause, you think, well, I don't even need to consider it. But if you are thinking like that, remember, in that case, you're not acknowledging the potential health benefits that hormone therapy can provide, particularly as they relate to improving cardiovascular health and also cognitive function. But I want to tell you something. If you're going to do research in this area, you're going to find this. Some research is going to report that hormone replacement therapy improves cardiovascular health. Other research will say that it actually increases cardiovascular disease risk. Same thing with cognitive health. Some research will say that it improves cognitive health. Other research will say that hormone replacement therapy doesn't have any impact on cognitive health. I'm going to lean into the one health benefit area that everyone agrees with, and this is bone health. Here's a quote that researchers made in a published study. The average decrease in bone mineral density during the menopause transition is about 10%, meaning that half of the women are losing bone even faster, up to a 20% loss in the 5 to 7 years around menopause. For example, Dr. Leslie Gersman sent me some research that reported that estradiol levels need to be at least 60 picograms per milliliter in order to prevent bone loss during postmenopause. And did you notice that I'm using the term estradiol rather than estrogen? If you didn't watch the previous episode, in that episode, I debunked a ton of the fear-mongering that has dominated the hormone replacement therapy space as a result of the Women's Health Initiative study. And I gave a quick primer on the differences between estrogen, estradiol, progesterone, and progestin. Now, when we look at my wife's blood work, where we looked at her estradiol levels from a few years ago, what we see is that her blood levels were less than 5 picograms per milliliter. And I would ask you, are these at a level that would help protect her from bone loss in her postmenopausal years? The answer is no. They are not at a level of 60 or more. They're less than 5 in this blood report. Now, what about a year later? We waited about a year and we took another blood test to look at her estradiol levels, and you'll see once again, very low, less than 5 picograms per milliliter. Now, do you understand what happened here? There was an entire year of my wife living with estradiol levels that are low and not protective of her bone health. She's living an entire year with suppressed levels of estradiol, such that she's more likely going to lose more bone mineral density than if she had higher levels of estradiol. So you may ask, since I'm helping my wife through this phase, what in the world was I doing? Why didn't I address this? I have the same questions now that I look back. But here's what I was doing during this time. I was reading research. I was reading books on menopause. I was reading the Women's Health Initiative study, having conversations with doctors about hormone replacement therapy, having other conversations with menopause experts about HRT. Remember, just a few minutes ago, I told you that there's a lot of conflicting information in the research literature about hormone replacement therapy and cardiovascular disease, cognitive function, cancer. Well, that's what I was reading about. I was trying to educate myself on these different areas. I didn't want to encourage my wife to take hormone replacement therapy if the risks outweighed the benefits. So if you tell me that you're nervous about starting hormone replacement therapy, I get it. I was there too. And to be clear, I'm not telling you to take hormone replacement therapy. That is a decision between the patient and her evidence-based physician. But I am encouraging you to be open-minded about this. Right now, I want to talk to women who are currently considering taking hormone replacement therapy. I want to go over 3 different items. What you should do next, how you should frame your HRT use, consider that the timing of your decision may be important. Okay, 1, what should you do next? I would encourage you to get blood work. Get your blood levels tested. Specifically, what is your estradiol levels? What are your progesterone levels? And I also like to get follicle stimulating hormone levels. My biggest regret in helping my wife is that we didn't start hormone replacement therapy sooner, and that I wasn't getting specific blood work years before we actually did. Also, as you're considering this, I would be surprised if you are a one and done hormone replacement therapy user. Now, what I mean by that is I want you to think about when you start hormone replacement therapy, it's going to be a process. I think it's rare that your doctor just gives you hormone replacement therapy and that's the dose you're going to be on for the rest of your life. There's going to be a period of adjustment until you get things dialed in. So I just want you to be prepared that it is more of a process and not just a one-time dosage decision. And think about this. 2 women could be prescribed the same estrogen pill, the same estrogen patch, and the same estrogen cream and have very different levels of blood estradiol in terms of their response to what they're taking. So I would encourage you to get blood work so that you know how well your body is absorbing the estradiol that you are currently taking or that you will be taking. And there's a little bit of a disturbing trend that I'm seeing, and this trend is that some healthcare professionals just aren't recommending getting blood work done. They're not getting any actual data to verify how well the body is absorbing their estradiol medications. So please advocate for yourself. ask for blood work. Because remember, you're going to want to make decisions based on data rather than on more subjective things. So you want to compare how you're feeling to the actual data. And we get this data through blood work. The second thing that I want to discuss is how you should frame your hormone replacement therapy use. We can't assume that it's going to solve all of your problems. For some women, it's going to feel like it has, but this is not a universal experience. Now, in terms of feelings or how starting hormone replacement therapy will make you feel, I've had thousands of communication points with different women, and I want to thank all of you that have been sharing this with me. And I want to now summarize what I've learned through all of these communications. So 90 times out of 100, when women have started hormone replacement therapy, what they tell me is it's been the best decision of their life. They feel much better, they have more energy, they don't have as much anxiety. It's been a very positive outcome for 90% of the women who have communicated with me. About 8 times out of 100, women are telling me that it's really not making any difference. They don't feel any different, and they even question if they want to continue taking it. And then about 2 women out of 100 tell me that it actually has made them feel worse, that they've had to stop. Now, is this surprising that different women will have different experiences from their hormone replacement therapy use? I don't think so. Listen to this. Some women get bloated and depressed on oral contraceptive pills. Others do not. Some women get bad PMS symptoms every month. Others do not. Some women get debilitating nausea when they're pregnant. Others do not. Women can also vary from month to month and pregnancy to pregnancy. How women will respond to hormone replacement therapy is really no different than these other varying experiences. So how should you frame your hormone replacement therapy use? Are you ready for this? I want you to look directly in my eyes when I say this. Hormone replacement therapy serves your fitness lifestyle. I do not put hormone replacement therapy up on a pedestal of greatness by itself. What we want to prioritize is a fitness lifestyle for everyone. Fitness is the goal, and hormone replacement therapy can help us achieve that goal. If we feel better, we can train better. If we get more quality sleep, we can build more muscle. And if we have to lose excess body fat, getting adequate sleep can help us attain that goal as well. To demonstrate this, I want to highlight a research study. Researchers took postmenopausal women. Their ages range from 40 to 54 years old. They had women who were either taking hormone replacement therapy in one group, and then the other group were women who were not taking hormone replacement therapy. This study was a 12-month study, and when we have studies that are this long, we get really good long-term data. Within each of these groups, they actually had subgroups. So the hormone replacement therapy women were subdivided into an exercise group and a non-exercise group. Just like the non-hormone replacement therapy women, they had subgroups where some of them were assigned to doing exercise and the others were doing no exercise. So what we have here is 4 total groups. Now, what did the exercise program consist of? They had them do resistance training plus walking and agility drill. Now, if you go back into one of our earlier episodes, you know how much I love combining resistance training with agility training. So I applaud the researchers for this exercise program that they used in this study. First thing we want to look at is what happened to the global outcomes compared with the women who were exercising, compared with the women who were not exercising. What we find is that the women who were exercising, regardless if they were taking hormone replacement therapy or not, over the year they gained about 1 pound of muscle, while the women who were not doing any exercise, they actually lost a little bit of muscle over this year. In terms of body fat, the women who were exercising, they lost a little over 1% of body fat, while the women who weren't doing any exercise, they actually gained a little bit of body fat. The only group of women to have lost muscle mass and that gained body fat was the women who did not do any exercise and they didn't do any hormone replacement therapy. What did this study teach us? Well, it taught us that the best thing you can do is to exercise. When you exercise, you build muscle and lose body fat. The next best thing you can do is to take hormone replacement therapy according to this study. The worst thing you can do is to do neither, to not exercise and not take hormone replacement therapy. This study, with a very similar design, showed nearly identical results. Exercise provided the best outcomes regardless of hormone therapy use. The only group in this second study to lose muscle mass was the group who didn't do any exercise and who didn't take any hormone replacement therapy. The group in this study that lost the most body fat was the group who was exercising and taking hormone replacement therapy. Now, I'm not going to lie to you. As a fat loss researcher, when I first started reading the research on estrogen and fat loss, I was hoping or anticipating that estrogen therapy was going to be a fairly potent fat loss agent. But unfortunately, what I found was the research did not support my initial thoughts on this. But what I found was that estrogen therapy really wasn't a strong and predictable fat loss therapy. Now, we do have some research that clearly has reported that hormone replacement therapy does cause fat loss. We also have research that hormone replacement therapy does not cause fat loss. We even have research reporting that women taking estradiol lost less body fat than women not taking estradiol. As diverse as these research outcomes are, I think it's a great reflection of what women's actual experiences are regarding their hormone replacement therapy use related to body fat outcomes. Some women are going to lose body fat with estradiol. Some women won't lose any body fat with estrogen. And others may lose less body fat when they're taking estrogen compared to if they weren't taking estrogen. You know what's true in all of this research? When you combine exercise with hormone replacement therapy, I've never read a study where the outcome was an increase in body fat gain. What I see when I read all of these studies is that combining exercise and hormone replacement therapy, it results in either fat loss or no change in body fat. And to be clear, exercise seems to be the most potent variable when it comes to lowering body fat and increasing muscle mass. The final point I want to make is that the timing of hormone replacement therapy may be important. This is referred to as the timing hypothesis, or the window of opportunity of hormone replacement therapy. When you read the hormone replacement therapy research, you're going to see this timing hypothesis come up as it relates to heart health and overall chronic disease. Here's how cardiology researchers summarize this concept in one of their published studies. Hormone therapy appears to exert its greatest benefit when initiated in women before 60 years of age and or within 10 years of menopause. What's interesting about this timing hypothesis is that I came across other research that appears to report the same thing as it relates to muscle mass. Now, there has never been a window of opportunity or timing hypothesis of hormone replacement therapy as applied to muscle physiology, but maybe there should be. In this randomized, double-blind, placebo-controlled study, women were divided into two menopause groups. One group was early postmenopausal women. What this means is that they have gone through menopause within the previous 6 years. And then there was a late postmenopausal group who had been in menopause for at least 10 years. Both groups wore an estradiol patch that supplied 0.5 milligrams of estradiol or a placebo for 7 days. The researchers measured genetic markers of muscle protein breakdown. Now, when we're looking at building muscle or maintaining muscle, we want muscle protein synthesis levels to be as high as we can, and we want to lower muscle protein breakdown levels. So we want muscle protein breakdown to be lower, not higher. And the researchers in this study, they measured genetic markers of muscle protein breakdown. What they found was that estradiol decreased these genetic markers of muscle protein breakdown in the early postmenopausal women by about 30%, but in the late postmenopausal women, the estradiol actually caused an increase in these genetic markers of muscle protein breakdown. So that was about a 50% difference between early versus late postmenopausal women when they both took estradiol. Here's what the researchers said about their findings. We found anti-catabolic effects in women who were less than 6 years postmenopause, but an adverse effect in women with greater than 10 years postmenopause. This study mimics what we see about the timing hypothesis as it relates to cardiovascular disease. And what we see is that there appears to be an advantage to starting hormone replacement therapy earlier rather than later. I want to end with one final thought about hormone replacement therapy, kind of as a placeholder for you to consider. This is feedback from one woman who shared her hormone replacement therapy experience, and this is also a woman who embraced a pretty impressive fitness lifestyle. And here's what she told me. She said that related to her workout, prior to starting hormone replacement therapy, she had no motivation and no energy to do her workouts. When she started taking estrogen and progesterone, she now had motivation to do her workout. But when she was done and got home, she just laid on the couch to recover. She didn't have a lot of motivation to do anything other than just her workouts. And then her healthcare provider added testosterone to her estrogen and progesterone therapy treatment. And what she said now, for the first time, she felt like her old self. Now, it's not uncommon for physicians who are treating women who embrace a fitness lifestyle to also prescribe low levels of testosterone along with estrogen and progesterone. There's very little research on this topic, but I didn't want to have an entire episode about hormone replacement therapy and not at least mention that this does happen in some women, especially women that are embracing a fitness lifestyle. Tell me about your experiences with hormone replacement therapy. Have you started taking hormone replacement therapy? And for those of you that have also included testosterone as part of your treatment, how has that been? Has it helped with your energy levels? Have you found yourself building more muscle? Also, I don't want to just hear success stories. If you're taking hormone replacement therapy and it's not been a good experience for you, please let me know that as well. Also, just let me into your decision-making process. What questions do you have now? And for those of you that are considering this currently, check out Hone Health and see if what they offer would be beneficial to you. Join me in the next and final episode where we talk about the entire series. So we put a bow on the entire series. And I'm also going to discuss what my research lab is currently doing to investigate this weight loss resistance phenomenon that we see that some women are experiencing during this phase of life. Are you liking this Menopause Fitness series? Please comment, like, and subscribe to my YouTube channel.